Welcome back to the award-winning Hometown Health, Good Things for Those Who Wait. The American Diabetes Association designates November as American Diabetes Awareness Month. This year's theme, A Day in the Life of Diabetes, encourages Americans to upload personal photos to the organization's Facebook page to show how the disease impacts their daily life. Nearly 26 million children and adults in the United States have diabetes. Another 79 million Americans have pre-diabetes and are at risk for developing type 2 diabetes. The specialists at Lakeview Internal Medicine explain their commitment to identifying the disease and how it impacts their patients.
Diabetes. It's a common disorder. Most of our patients are taking oral medications. Now the thing is, if you don't control the sugars very well, there are ramifications down the road. Increased incidence of heart attacks. The statistics is that 80% of diabetics actually will die of heart disease. Increased risk of stroke. Probably I think diabetes is one of the biggest risk factor for getting a stroke or mini strokes. It can affect the kidneys. 50% of dialysis in this country is because of diabetics who have had their kidneys affected by the disease. Neuropathy, which is tingling, burning, numbness in the toes. Again, all these ramifications of the disease is related to how well you control their blood sugar. Now, if you keep the blood sugar pretty much close to that of a normal person, I'm not saying the disease is not going to progress, but you can delay the progression of these conditions a long way down the road. If we are aggressive in our approach to treating the disease at an early stage and keeping it well controlled over a period of years, all these problems can be well taken care of. In this area, and especially I think in America, the problem is being overweight or being obese. Majority of our diabetic patients which I see, they have a problem with being overweight or being obese. And it is modification of diet, changing your lifestyle habits. We do promulgate that, but I think it takes a lot of part on the patient to be motivated enough to be able to do those things and to make a dietary lifestyle change which is very different from what they have been eating before. Second thing is exercise absolutely plays a big role. Usually I tell my patients at least 20 minutes of exercise every day on a regular basis. Third thing is of course having an active lifestyle, keeping themselves busy, keeping themselves occupied, being compliant with their medication. Thankfully most of the medications now on the market have gone generic, so it doesn't tax the senior's pocket that much.
Lakeview Internal Medicine has 4 offices throughout Lake County, including Summerfield, The Villages, Leesburg, and Mount Dora. To learn more about the importance of diabetes care and management, and to contact the specialists at Lakeview Internal Medicine, follow the Diabetes Care StoryLink icon on our homepage, yourhometownhealth.com.